Bruce Springsteen, who is 74, just came out with a statement on X saying, quote, "Continuing to recover steadily from peptic ulcer disease over the past few weeks and will continue treatment through the rest of the year on doctor's advice." So what exactly is PUD? And in this context, PUD in someone who's age 74. Peptic ulcer disease refers to the formation of open sores called ulcers in the lining of the stomach or the upper part of the small intestine known as the duodenum. These ulcers, they can lead to a variety of symptoms and complications depending on different factors. One of the most common causes of ulcers is taking too much NSAID medication, meaning non-steroidal anti-inflammatory drugs. We're talking about things like aspirin, Advil, Aleve, ibuprofen, naproxen, Toradol, and the like. How or why these drugs in particular cause damage to the stomach and intestines? Well, they actually erode the protective mucus layer that lines the stomach and the duodenum, and that leads to ulceration. And there are other things that make people more prone to getting ulcers, things like smoking and excessive alcohol consumption, and even radiation therapy. But another somewhat common cause is H. pylori, which is a nasty bacteria. This little bugger can cause an infection of the lining of the stomach, which leads to inflammation and eventually an ulcer. And then there's less common causes of ulcers, like a rare disorder known as Zollinger-Ellison syndrome, in which the stomach produces too much acid. Now, the most common symptom of PUD is burning stomach pain or a gnawing type of belly pain in the upper middle portion of the belly. And that can typically be relieved by taking acid neutralizing medicine like Tums or Pepto-Bismol, or acid reducing medications like Pepcid or Prevacid. People can also get this feeling of fullness and bloating or excessive belching, as well as feeling nauseous. And eating fatty or greasy foods tends to make things worse. Sometimes the ulcer can cause bigger issues if it's severe or if it goes untreated. For example, you could have bleeding there, and that bleeding can lead you to vomit blood. That blood can either be fresh, bright red blood, or it can be a little bit of blood that actually mixes with the stomach acid, producing a vomitus that looks like coffee grounds. Or you could have stools that look very dark and tarry, or if it's a lot of blood, could give you bloody stools. Sometimes the bleeding is so bad it can cause someone to go into hemorrhagic shock with possible death. Another complication that can occur is perforation. Literally, the ulcer in this scenario eats through the wall of the stomach or intestine. And yes, this is very bad because not only does it cause intense belly pain, it leads to infection of the peritoneum, known as peritonitis. And this often brings on septic shock and potential death. Sometimes the inflammation from the ulcer causes an obstruction, which blocks the passage of food there. This can cause early satiety, distension of the belly, and even weight loss. The diagnosis is made by doing a procedure called an upper endoscopy. More specifically, the procedure is called an EGD, which is just a fancy way of saying that a doctor inserts a thin rubber tube with a camera and a lens at the tip, and it goes through the mouth down into the stomach, or actually goes into the esophagus first, then into the stomach, and then into the duodenum. And this is done in order to visualize what's going on there. And in some cases, take biopsies or do some kind of therapeutic intervention. For example, if there's an ulcer there, the doctor might want to take a biopsy to test for H. pylori. Other tests for H. pylori include doing blood tests, stool tests, and a breath test, but testing for H. pylori is a complicated topic for another video. Treatment for H. pylori is also complicated, as there's various regimens involved that involve like 2 or 3 antibiotics for a couple of weeks just to eradicate the bacteria. And then there's treating the ulcer itself by reducing acid production in the stomach by taking acid reducing medication, talking things like omeprazole. There's Prilosec, Protonix, Prevacid, Nexium, and Dexilant. Sometimes PUD, it's not a big deal and is easily treatable, but if it's severe or if it goes untreated, it can actually be something serious.